As a landlocked nation, Chad relies on existing water sources to meet the needs of its citizens. Its dependency on Lake Chad, the nation's primary source for fresh water, has been of foremost concern. Once the third largest water supply in Africa, Lake Chad, subject to the detriments of global climate change, has decreased by 90% since the 1960s. Presently, whole communities once sustained by fishing practices rely on agriculture for food, a practice increasingly difficult as the region continues to suffer from intense droughts. The rapid disappearance of an essential resource to millions of people represents Chad's most urgent dilemma. A provision of a sustainable and accessible water supply is crucial for Chad to ensure the well-being of its citizens and stimulate its overall development. This is the ambition of the Chad Water Initiative. Our mission is to accelerate Chad's path to development by guaranteeing the availability of clean drinking water to all its citizens. Our vision statement is to target Chad's environmental and humanitarian challenges through economic stimulation and the provision of a sustainable water supply. With the creation of our C.W.I. and with our partnership with Turkish NGO and Charity Humanitarian Relief Foundation, or IHH, we aim to establish a long-standing freshwater supply for Chad through water well projects. Each 120-meter well will ensure the safer attainment of clean water for thousands at a time, which in turn will benefit local communities by combating the cycle of poverty through improved health and food security. The guidance of IHH, with prior experience in building 6,800 wells across 36 countries, will guarantee a safe and effective project. However, even a partnership with the IHH cannot remove the risks of well construction. Both water contamination and political conflict are potential challenges associated with this program. Educating local individuals on maintenance strategies can easily eliminate the first risk. The second, however, can be mitigated through the C.W.I's cooperation with the requests of Chad's government in exchange for future financial contributions. For the Well Water Initiative to be a success, the C.W.I. must gain the permission and involvement of Chad's leaders. To indicate long-term success, the C.W.I. can compare regions with and without water wells at the onset of our program, both to measure room for improvement and their impact on local communities. Given the effective implementation of our first objective, the C.W.I. will proceed by turning its attention to Chad's suffering economy. A project of this size requires well-trained workers to make it a reality. The C.W.I. intends to employ the beneficiaries of this effort. Providing Chadians with jobs will not only allow these individuals to participate in water well projects firsthand, but it will create the type of employment opportunity a stagnant economy requires. In doing so, the C.W.I. expects the creation of 150,000 jobs with positions including project planning, management, construction, safety monitoring, and inspection, directly targeting the 6% of Chad's population currently unemployed. In combating unemployment by providing stable incomes, the C.W.I. expects traceable economic growth from the start of this program, with a steady decrease in extreme poverty over the next 5 years. The C.W.I., as stated, intends for the project to consist exclusively of Chad citizens, with the exception of individuals currently employed by the organization. This requires a government-subsidized training program that will provide all employees with the tools they need to work safely and efficiently. The education process could prove both a delay of the program and a financial impediment. To add, the inexperience of newly trained workers can add an element of danger to the program, both to workers and local individuals. If fashioned incorrectly, wells can collapse during construction. Clearly, worker safety is a concern. For the C.W.I., enacting and enforcing strict safety standards will lower the potential for injury. While the C.W.I. is fully aware of these obstacles, its primary goal is not to simply provide clean water for Chad's citizens, but to heighten all aspects of development. In addition, a cost-benefit analysis conducted by the United Nations World Food Program finds that the provision of drinking water can directly encourage economic growth. Clearly, both the action and the result of the water well program will contribute to Chad's future economic growth. Should the water well project meet financial expectations, the C.W.I. proceeds by targeting Chad's humanitarian crisis. The economic stimulation generated by our water initiative will provide the opportunity for Chad's government to rectify the nation's most glaring deficiency, the absence of an adequate healthcare system. Chad ranks third of all nations in infant mortality, while battling the rapid spread of diseases like cholera, measles, and malaria. At the same time, 96.2% of health expenditures are paid out of pocket, and only 0.4% is covered by insurance. A universal healthcare system is a clear solution to these and many other problems. It will take a national effort, time, and great costs. The World Health Organization outlines 3 key elements of a national healthcare system. The first is affordability, because making Chad's health services inexpensive for their citizens is crucial. The second is availability of essential medicines and technologies, because they cannot effectively treat their patients without access to necessary supplies. Last and most important is a sufficient capacity of well-trained health workers that can provide essential services. The anticipated financial growth in Chad resulting from water well projects should be directed towards the education of medical workers. In a country burdened with a corrupt government, a national healthcare system can also bear risks. For an entire population to have equal access to healthcare with financial security, prepaid resources must be redistributed to those with the greatest health needs and fewest resources. This will be done through a commitment where medical treatment is issued equally among citizens. Our plan is only possible with the cooperation and help of the Chadian government. Historically, they have not been able to support their own healthcare system, so this is where we step in. Through the planning of the C.W.I. and the support and aid from the Chadian government, we can effectively establish a stable healthcare system in Chad. To indicate success, the C.W.I. hopes to see healthcare become a policy priority. At present, the Chadian government spends 3.6% of its GDP on health expenses. By 2025, we hope to see this figure reach 15%. Over the next 5 years, the C.W.I.'s involvement inside of Chad plans to yield future dividends for the developing country. During the first year, we will develop a plan of how to provide humanitarian supplies and aid to Chad. Then, during our second year, we will develop a stable employment system to further educate and create experience for the employees on the maintenance of established wells. After this, and during our third year, with the help of the local and national governments of the areas, we plan to attain government funding to support our development of the well systems in Chad. In our fourth year, we plan to begin our project and establish water wells in the surrounding areas of Chad. In our final year, the C.W.I. will begin its implementation of a newer and more stable healthcare system. This will happen through the distribution of up-to-date medical supplies and the hiring of more skilled officials, which will stem from the funding we've received.